Did you know drinking water is not 100% clean? According to researchers, there are just less than 10 nanograms of drugs in the water per liter. But there is not just one type of drug in the water, there are multiple types of it. Although these drugs are in a very minute amounts, we are exposed to it over a long period of time, 10, 20, 30 and even 60 years.
Example of common drugs: bisphenol A or BPA, an endocrine disrupting chemical frequently used in consumer plastics. Secondly, methotrexate, an immunosuppressant and cancer treatment drug. And there's also sulfamethoxazole, an antibiotic. And lastly, acetaminophen or paracetamol for fever and pain relief.
There are a few types of drugs. First, pharmaceutical, such as medication. Second, personal care products, which is fragrance, cosmetics, lotion, shampoo, and soap. And lastly, traces of illicit drugs found in waterways. And the question is, where the drugs come from? So, the source of drugs in drinking water is firstly excretion, and second disposal, and lastly agricultural runoff. Excretion is one of the source of drugs in drinking water. When a drug is ingested, it's metabolized, and what eventually is excreted is the portion of the original parent drug that doesn't get metabolized. 90% of the drug is metabolized. Digested drugs are either removed from the body as waste or sweat and then flushed down toilets or go down the drain in our showers. Secondly, disposal. For many years, people flush unwanted medication down in the toilet, and many people still do that despite updated federal guidelines that now advise people to either take unused drugs to a collection site or mix them with a coffee grounds and put them in the trash. And last but not least, agriculture runoff is the one of the source of drugs in our drinking water. This is because comprising livestock manure due to the use of antibiotic on the livestock.
All sides of the debate agree this is not known for sure. We don't have evidence of a health effect, although it's an area of concern and one we will continue to look at. Still, utility companies argue that the water is completely safe. We can't say for sure whether the levels of drug in drinking water are low enough to discount harmful health effects. It is true that the levels of medications found in drinking water are very low, but especially when it comes to pharmaceuticals that are synthetic hormones, there is a concern because hormones work at very low concentrations in the human body. We don't want people to be alarmed and think they can't drink their tap water or that they shouldn't be drinking water. We know that kids, including babies and toddlers as well as fetuses, are more susceptible to environmental exposures because their bodies are still developing and their exposure on a pound per pound basis is higher, and they lack the detoxification system like adults have, so it is not unreasonable to expect they will be at a higher risk. Boiling will not solve the problem, and forget bottled water as a way to escape the low levels of drugs found in some public water supplies. 25% of bottled water comes from the tap. Home filtering systems such as reverse osmosis may reduce the medication levels.
So, how can we reduce pharmaceutical drugs in drinking water? There are a few ways to do it. On an individual level, we can take unused drugs to a collection site or mix them with coffee grounds and put them in the trash. Secondly, we can also limit bulk purchase because big bottles of unused pills would create opportunity for medication to end up in water. On a governmental level and society, drug take-back programs can be implemented. Community collect drugs at a central location for proper disposal. And government can also implement biodegradation to have bacteria feed and break down these drugs, thus eliminating it from water sources. Although our water is not 100% free from contaminants, it's safe to drink. There are no proven detrimental effects of it to our health. But if you want to be on the safer side, you can use water filters to better guarantee your health.